Hi everyone, this is Praveen S. Patil here. Today we are going to look into the Frey's syndrome. What is Frey's syndrome and what are the synonyms for that? The other synonyms for the Frey's syndromes are auriculotemporal syndrome or auriculotemporal nerve syndrome. See, Frey's syndrome commonly appears secondary to the injury of the auriculotemporal nerve or tiny branches of the auriculotemporal nerve. Hence, we call it as auriculotemporal syndrome or auriculotemporal nerve syndrome. Gustatory sweating is also called as gustatory sweating because at the time of the mastications, there is a sweating which appears either on the cheek, face, and this area, particularly at the time of the mastication or whenever the patient look into the food. So, hence it is called as gustatory sweating. It is also called as Frey's syndrome because he is the first person who noticed the appearance of the sweating, and Frey is a neurophysician from the Poland who has given the detailed explanation about the disease. Hence it is called as Frey's syndrome. As I told earlier, this is first documented in 1853, whereas a detailed explanation is given by the Poland neurologist Dr. Lucy Frey in the year 1923. Hence, we are calling it as Frey's syndrome, and he named it as auriculotemporal syndrome. So, what is Frey's syndrome? This is localized unilateral or bilateral facial flushing. See, if it is a nerve injuries by the parotidectomy and all, so this is a unilateral, usually it will be unilateral, and bilateral in case of the children who has underwent the forceps delivery where there is a chances of getting the injury to the auriculotemporal nerve. So in those cases there will be a bilateral facial flushing with or without associated with the hyperhidrosis, with or without. See, a literature says in post-parotidectomy cases, nearly about 80% of the patients are having the Frey's syndrome, and where only the facial flushing is seen, and hyperhidrosis is seen in case of nearly about 40% of the cases. So usually patient comes with hyperhidrosis after 1 year of the surgery of total parotidectomy. In the auriculotemporal nerve territory that is induced by the masticatory or tactile stimuli is known as Frey's syndrome. That is localized erythema may be seen, either it may be unilateral or bilateral. Facial flushing will be seen, associated with, or may not be associated with the hyperhidrosis, that is sweating, in the auriculotemporal nerve territory that is induced by the masticatory or tactile stimuli is known as Frey's syndrome. So what are the symptoms, signs and symptoms we get? One is sweating at the temporal, retroauricular, that is behind the ear, cheek after eating the food, usually seen in the first year after the surgery, that is in the near the parotid gland area. So what is the treatment for this? Botulinum toxin 0.1 ml at every 1 to 2 centimeter affected area until the bleb was shown. So this is the only area effective treatment, and other treatment like local flap like sternocleidomastoid muscle flap and all. There are so many methods, and this is, as per the literature, this is more widely and comparatively more effective treatment for that. So this is about the Frey's syndrome. If you like this video, then kindly subscribe and press the bell icon. Thank you. Thanks for watching my video.